Hypertension is extremely common among our patients on hemodialysis, and one of the issues is which method of measuring blood pressure should we be using in hemodialysis patients? Should we be using measurements in the dialysis unit, measurements outside the dialysis unit? So for clinicians, it can be very confusing to figure out which method we should be using, especially considering how important hypertension is in our dialysis patients. So there's been a lot of data, mostly from Dr. Rajiv Agrawal from Indiana, done a lot of extensive research in this area suggesting that really home blood pressure monitoring should be used in our hemodialysis patients because it not only helps you to diagnose hypertension outside of dialysis, but it also is associated with outcomes like target organ damage and mortality, and suggests that really there is a role for home blood pressure monitoring in our hemodialysis patients. There are two issues when it comes to blood pressure in dialysis patients. There's the issue of hypertension itself, meaning the absolute level of blood pressure is associated with worse outcomes, but the other thing that's associated with bad outcomes is the pattern in blood pressure like you're suggesting. So patients who have what we call intradialytic hypotension, meaning their blood pressures plummet during dialysis, or the unique set of patients whose blood pressures go up during dialysis, this has also been associated with increased morbidity and mortality. So we're not entirely sure which one's more important. Is it better for our patients to have some hypertension but no hypotension during dialysis? Or is it better for our patients to have no hypertension but have occasional hypotension during dialysis? The relative importance isn't entirely clear. It's definitely a long-term issue, certainly not a short-term issue for our patients dealing with the highs and lows of blood pressures during dialysis. And it's something that certainly doesn't go away the longer you're on dialysis. Unfortunately, it's something that does come with the process and the procedure. However, there are people trying to look for better ways of figuring out how much fluid do our patients really need to have removed during dialysis, and going beyond the concept of dry weights and guessing almost. There's no middle ground at this time. People are looking for alternative ways for renal replacement therapy, whether it's the artificial kidney, the wearable kidney. But the other thing is certainly there are different modalities of dialysis that may improve morbidity and mortality. But you're right, inherently it's at this point dialysis or transplant.